Did you know 1 in 5 people suffer from vein disease, such as varicose veins and spider veins? And our next guest says if left untreated, the symptoms can be lifelong. This is Dr. Gamal Wazni. He is the founder of United Vein Centers. Good to have you with us. You're here to help for all those people who have been suffering. First off, what is vein disease and what are some of the most common symptoms?
Vein disease is when the vessels in your legs become dilated and diseased. They will not return the blood to your heart. They start to hold blood. That pooling leads to heaviness, aching, and swelling. At night, you can get restless legs and leg cramps.
So what age group most likely will see these symptoms?
Starts in your 20s, but you may not realize it. Every decade, it gets worse. By the time you hit your 40s and 50s, you start to really feel it.
Wow, so you can almost spend a lifetime dealing with this. And you were saying this isn't just cosmetic. There are some medical reasons why we need to address vein disease.
Correct. True vein disease is truly a medical problem that gets worse with every decade of life. The veins may look unsightly, and that's where the cosmetic issue comes about. But if you feel pain, aching, and swelling, that's a medical root cause.
Yes, and you all are taking precautions, I know, there at United Vein Centers to make sure that patients feel safe during COVID.
Yes, everyone's wearing masks, frequent sanitization, and we're moving patients through the waiting room very quickly so that no one is waiting in the waiting room.
So let's talk specifically about varicose veins. That's the bigger type veins than the spider veins. What do you all do there at United Vein Centers to treat that?
Well, if you see varicose veins and your legs, in addition to that, feel tired, they swell, they ache, or if you get restless legs or leg cramps, what we're doing is treating those bad vessels under the skin with lasers. We heat them closed. Back in the day, it used to be vein stripping. Today, it's in the office with lasers, medical lasers.
So the recovery time, I can imagine, is shorter.
Correct. You drive yourself to the office and you drive yourself home. There's literally no recovery.
All right, so for all of those folks watching who've been putting this off, Dr. Wazni, let's talk specifically about the kind of results that patients are sharing with you after they go through this treatment.
Those that come in with the pain, aching, and swelling of vein disease, once we treat them in the office, we identify the bad vessels and treat them with the medical lasers. They're reporting back to our doctors within a month that their pain, aching, swelling is gone. Many that had the restless legs and the leg cramps at night are sleeping through the night. So it's making a big difference to treat these diseased veins.
There's a lot of options out there when it comes to treating this. Why should we pick United Vein Centers?
The medical doctors at United Vein Centers are board certified doctors. They're doctors that have devoted their careers to treating vein disease. So at all United Vein Centers, the doctors only treating vein disease every day. They get very good at it.
Yeah, I can imagine. I'm sure that's peace of mind for a lot of folks. And when it comes to something like this, a lot of people say, I can't do it because I don't have the insurance to cover this kind of treatment. Do you all accept insurance there?
We accept all insurance, whether it's Medicare, Medicaid, commercial carriers like Blue Cross Blue Shield. Because it's a disease treated by medical doctors that affects your quality of life, it's covered by health insurance.
Right, that's wonderful. We want to get back to life. I'm sure people have a lot of living to do. They don't want their legs and vein disease to be a problem.
Correct.
Awesome. Yes. Well, Dr. Wazni, thank you so much. We appreciate you, and we want to give you some information. Don't wait a second longer. Call 1-800-NEW-LEGS. Their representatives are standing by now to schedule your free vein screening. Insurance, Medicare, and Medicaid are accepted. Some restrictions may apply. Call United Vein Centers for details. That number again, 1-800-NEW-LEGS. You can also find them online at unitedveincenters.com.